Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about cardiovascular health, Alzheimer's disease, and the effects of pregnancy on heart health. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Here we are, 2018, and heart disease is still the #1 killer of men and women in this country. Kind of hard to digest, but there are so many efforts going on in our community around the country to make a big dent in that. My guests know that all too well. They know the facts, the figures, the whole picture that we're looking at in Middle Tennessee. Welcome to both of you, Denise Costanza and Ted Cornelius. Glad to have you both here.
Thank you.
Thank you.
Okay, so tell us a little bit about your organizations and your mission, really, to change the face of heart disease in our community. Either one of you want to start? Ladies first, or doesn't matter?
Sure. So I'm with the American Heart and American Stroke Association. Our mission is to reduce cardiovascular disease and stroke and the deaths that occur from that. We are involved in a couple different major ways within our community. And so locally, we try to meet people where they are. So that could be in a faith-based setting, through their employers, through the clinical setting, and we have a wide variety of programs that really try to tackle cardiovascular disease through a multitude of ways.
And where people are, I like that, you know, targeting those communities, going to where people need you. Okay, Ted, you're with the Y, the Middle Tennessee Y.
Yeah.
Tell us about how your organization fits into this initiative, this plan.
Yeah, so the Y is for a healthier living for all. And so that means that we are very intentional about how we go about doing that. So we do it through examples. You know, we offer physical activity opportunities for many of the communities, but not just that, we are also very targeted in some of our programming related to some of the chronic illnesses that are facing Nashville and beyond. So for example, like with Denise, they're very focused on heart health. We're partnering with Heart to also address some of the heart conditions in Nashville and really believe that there's a systemic approach that's going to be very supportive to patient care. But it doesn't limit it from here. It also includes a lot of the healthcare physicians and others to get involved with this. And then we also do it through addressing other chronic diseases like diabetes. So we have a YMCA's diabetes prevention program that also works with clinicians and physicians and other community organizations.
Because, for example, diabetes has a lot to do with heart disease. I mean,
does.
if you're diabetic, the likelihood of having heart disease is a lot more likely, a lot stronger.
That's right.
Right, the odds. So, Denise, what is the status of heart health here in Nashville?
Yeah, so unfortunately, we're looking at about one in every 2 Nashvillians having high blood pressure, and only about half of that number have it under control. Nearly 1 in 5 are smoking, 1 in 3 have high cholesterol and are overweight. And so we're facing quite an instrumental and kind of epidemic proportion of health disparities in our community.
In 2018, that's what I can't get over. Is that in all ages? Is that more in the older population in Nashville and Middle Tennessee?
Unfortunately, it really runs the gamut, and depending on what risk factor you're looking at, it can affect different populations. But across the board, there are risk factors from infancy all the way to the older and stages of life that do affect people's heart health.
All right, so Ted, what are the organizations in Nashville doing about these conditions then?
So I'll tell you, we're fortunate in Nashville. We have a very strong collaborative partnership with many organizations. So you see 2 right here, the American Heart Association and the YMCA, very strong partners. But we also have partners like Nashville Health, which is Senator Bill Frist's organization that's also addressing the conditions of Nashville and others. So it's only as much as how we partner and collaborate with others that's going to allow all of us to make the greatest impact. And so we're very intentional about seeking other partnerships, and we all feel like we can't do this by ourselves.
Absolutely not. Being intentional has a lot to do with it, doesn't it? And the collaborations, that's vital. How can we really make a dent in this and prevent heart disease from happening in the first place? Because we know once you have it, you can obviously get better and improve greatly. But to prevent it in the first place, Denise, what are the things we can be doing?
So I think the first thing that's really component is being an advocate for your own health care, really understanding what risk factors you're facing, identifying those, and making lifestyle changes to accordingly. Additionally, something that we can all do is this week happens to be CPR week in America, and one of the big things that we can do to be really great citizens is if you go to handsonlycpr.org, there you'll be able to learn how to perform hands-only CPR, and that knowledge can save lives in our community, and we can make a dent on bystander CPR rates.
The bystander, I think, I remember when I was involved with the Heart Association a long time ago on the board, but just showing us demonstrations, you know, with the model, I hate to say the dummy, but the model that was used. And I think a lot of people are afraid sometimes to get involved. So how do you educate people about that?
I mean, to me, the Heart Association offers CPR training and other different training that gives people the confidence so that when an episode does happen, you have confidence going in knowing that you are able to supply some level of care. Denise can probably talk a little bit more about that.
And on that note, what are some of the, as far as the first signs of heart disease? You know, it's not always the crushing chest pain, especially for women. Kind of go over some of the symptoms.
Yeah, so the most crucial factor would be really talking to your healthcare professional to understand risk factors and how that may portray to you. For example, different forms of cardiovascular disease can affect people differently. Signs of a stroke can vary. And so really understanding what your risk factors are and having that conversation with your healthcare provider are important, but looking at some key risk factors. So for example, do you have high cholesterol? Is there a history of heart disease in your family? Are you smoking? Are you eating appropriately? Are you having too much sodium in your diet? These are all different aspects that you can modify before you experience a cardiovascular incident.
And we know the one risk factor we can't do anything about is what you've inherited, what's in the genes, but by modifying all these other lifestyle habits, or if you will, and weight and controlling other things can make a big difference. Okay, so tell us about resources then for the person watching saying, you know, I think I need to explore this a little bit or discuss this with my dad or my mom or my spouse.
Yeah.
What resources do people have in Middle Tennessee?
Yeah, so one thing we did last month was we brought together businesses, healthcare, a lot of different organizations. We did a partnership with Heart Association, Nashville Health around a summit that brought a lot of these support systems together to talk about what can we do more in order to be able to help support Nashville for some of these different things. So, you know, with the why, some of those programs that I talked about to reduce some of that risk. There's also programs through American Heart Association that are outstanding. But again, really us coming together and really continuing to hear from the patients is what is most supportive, and then us responding to that is really our best support.
All right, well, we appreciate you giving us your time coming in. We know several websites folks may want to check out, heart.org, www.heart.org, and www.ymcamidtennessee.org, midtn.org, to get a lot more information. Thank you so much for coming in.
Yeah, thanks for having us.
And we'll be right back. All of us, of course, forget things from time to time, but as we get older, you may get a little panicky thinking, oh my gosh, I'm developing Alzheimer's, or I'm developing dementia. My next guest does see a lot of elderly patients in her practice at Vanderbilt, Dr. Maria Duggan. Thank you for coming in.
Sure, thanks for having me.
So how do we distinguish, how do we know if the symptoms we're experiencing are part of just the aging process, or maybe dementia is in our near future?
Yeah, so the big difference is that with normal aging, there's no loss of function. So your processing speed may slow down. It may be harder to remember things. I really like the file cabinet analogy, that if you're 85, you have 85 years worth of files stored in your filing cabinet. It's going to take you a little bit of time, more time than it would to go through those than if you were, say, 30 years old and you were going through fewer files. So we know that processing speed slows down. Occasional forgetfulness can be normal. And those mild changes that happen with aging really don't impact one's ability to live independently and function day to day. So when we start seeing short-term memory problems or changes in thinking that impact one's ability to live independently, to, let's say, drive, balance a checkbook, to cook, to maintain yourself, your appearance, your social life, that's when we start getting worried about dementia.
So can you kind of describe the stages? I know there are different stages of dementia, what someone might experience and what it means to the person, not only with the disease, but we know it affects the entire family.
Right. So the stages of dementia, and dementia is just the umbrella term that we use to describe this syndrome that we see in folks as they develop memory or thinking problems that impact their function on a day-to-day basis. So basically there's early stage, middle stage, and late stages that we see. In the early stages, you may notice, like what I mentioned earlier, some problems in daily functioning with what we call executive function, higher order thinking, balancing checkbooks, being able to look at a bank statement and understand it, driving, getting lost in familiar places. And as the disease progresses, folks will lose more and more of those higher functions, and some of the basic functions will start to dwindle, like the ability to dress yourself, pick out your clothes, to toilet yourself, to bathe, etc. And that's the middle stages, which tends to be the longest. The late stage in dementia, folks are pretty much dependent with all of those basic activities, dressing, eating, walking. Communication is often severely impaired. They may not be able to speak very many words. They may not be familiar of their surroundings.
What it most commonly comes on, I'm guessing now after 70, 75 typically, but there are cases of early onset dementia and Alzheimer's. Is that still rare, or are you seeing more of it?
It is rare. It's the minority of cases, but we do see some cases of adults in their 40s or 50s developing Alzheimer's disease or other forms of dementia. Of course, there are many forms. The younger cases, it's always difficult, but it's especially difficult, let's say if you have a teenage child at home and you know dad's developing dementia. It can be pretty challenging, and most of the early onset tend to be familial or inherited forms or folks with a genetic predisposition.
Is there anything people in that subset, is there anything those people can do to prevent it?
Not that we know of yet. Of course, there's many ongoing research studies that are going on to try to understand that, basic mechanism, which tends to be based off of genetic changes. And so we're hopeful that there may be some therapies down the road, but at the time, not that I'm aware of.
So once someone is diagnosed with Alzheimer's, what can he or she expect?
So it depends when they're diagnosed. Of course, we know that Alzheimer's disease is diagnosed typically in the middle stages. So folks have already had symptoms for a few years before they actually come to a doctor and get formally diagnosed. And everyone's trajectory is a little bit different. Of course, you hear on average the lifespan is about 10 years, and you progressively decline in terms of your ability to take care of yourself, your ability to talk, eat, walk, etc. But everyone progresses at a different rate. We like to start planning as early as we can. So once we have a diagnosis, we like to engage with the family members in thinking about advanced care planning while the patient is still able to talk to us and express themselves and tell us about their values and their preferences and their goals, knowing that they now have a terminal diagnosis.
Let me ask you this in our final minute here. What impact are some of these meds having as far as slowing the progression of the disease?
So
Can you give us some hope?
Yeah, so in the early stages, we do use acetylcholinesterase inhibitors. Those are ones like donepezil or Aricept, and they can often slow down the progression. They're not magic bullets. They don't fix the problem, but they can also help not only with the cognitive symptoms, but also with the functional decline and prevent patients from having to live in nursing homes as the disease progresses.
So tough on the entire family unit, and the caregivers need help too along the way.
Absolutely.
All right, Dr. Duggan, thank you so much.
Sure, you're
Appreciate
welcome.
you coming in.
Happy to be here. Thanks.
All right, and a lot more coming your way right after this. Pregnancy stresses a woman's heart and circulatory system. Even if she is in great health, it can really happen to anybody who's pregnant. My guests know about this. This is one of their specialties, and my guests are Dr. Connie Graves and Dr. Stacy Davis. Thank you both so much for coming in today.
You're welcome.
On a hectic day for you both. Tell us a little bit about the Perinatal Cardiac Center at St. Thomas and what kind of patients you see.
So we started the center in 2015. And it was in response actually to the American Heart Association's mandate that women with preeclampsia have follow-up. And I thought, well, how will anybody ever do that unless we start a center? And in that we decided that we would see people preconception, women with heart problems or history of heart problems who are thinking of getting pregnant. We would see women during the pregnancy, and then we would follow those women postpartum. In addition, we would see those women who are at risk for heart disease later in life, including patients with a history of preeclampsia during a current pregnancy, hypertension, or diabetes.
Okay, so Dr. Davis, how does pregnancy affect the heart?
Pregnancy has a lot of effects on the heart. The number one effect is that when you're pregnant, the amount of blood circulating in the system increases significantly, and that can lead to increased swelling. Your heart has to work harder during pregnancy, so if your heart has to work harder and you have an underlying heart condition, it can tax the system. It can cause high blood pressure. There are a whole bunch of things it can do, and that's why it's so important for a woman to get close prenatal and postnatal care, especially if they have a known heart condition.
Okay, and again, even if you're fit,
Even if you're
it
fit.
can happen.
Yes, because preeclampsia occurs in about 6 to 10% of all pregnancies. Often, besides the fact you may have a family history of high blood pressure or underlying heart disease, that may be your only history. So, and it's usually a disease of first pregnancies. So you won't even know that you have any risk factors until you're well into the pregnancy.
Oh my, all right. So what complications appear to be linked to heart disease? Either one of you, whoever wants to answer that.
Well, some of the things in pregnancy that are linked to heart disease are preterm labor, intrauterine growth restriction, where the baby is small and doesn't grow well, preeclampsia that we've already talked about, gestational diabetes, and interestingly, stillbirth can all be linked to the possibility of developing heart disease in the future.
That was my next question. So what about later in life? So these pregnancy complications could lead to future cardiovascular problems? Dr. Davis?
Exactly. So preeclampsia has been associated with increased risk of stroke and also subsequent heart disease, blocks in arteries. Many individuals we found who have preeclampsia, they may have clotting abnormalities, they may have abnormal cholesterol, and left untreated, the effects on the heart can be significant. They can lead to heart attacks and other complications. And it's not uncommon, we have found, for women, once they get in that window between childbearing and menopause, they may not see an OBGYN or a general internist for many years until an event such as a heart attack happens. So we want to increase awareness of women. We want them to take charge, know what puts them at risk for heart disease, and act now when they can prevent heart disease.
Do you find that some of this information is surprising to some of the women who come in first time
Well,
moms?
what I think is surprising to everyone is that cardiovascular disease is the #1 killer of women. Not just
Yes,
women
you
who
bet.
are menopausal. It is the #1 killer of women in pregnancy. is the leading cause of maternal mortality. In pregnancy.
My goodness, how frightening. So what if you get pregnant after you've been diagnosed with some type of heart abnormality or experienced a heart attack? Then what?
Then you need to see both a cardiologist and a maternal fetal medicine specialist who will work closely to help care for you, because we can get you through your pregnancy, and our job is to make sure that you do well and your baby does well. You require more attention than the average woman who's pregnant.
More frequent appointments.
More frequent appointments, and keep in mind that some of the congenital heart problems, such as valvular problems or things of that nature, may also be reflected in the baby. So that not only does the mother need follow-up, but the fetus needs to be seen, needs to be have good ultrasound and be scanned by someone who's skilled in taking a look for these abnormal fetal heart conditions.
What are some of the things that the mom, the pregnant woman, could do to make the pregnancy healthier for her and for her baby? What are some of the things that you advise them on, as far as, is it diet, is it exercise, or is it more medication?
It actually starts preconception. If you're thinking of getting pregnant and you know that you have a heart condition, before you get pregnant, go see a maternal fetal specialist and or go see a cardiologist who specializes in this to help you assess your risk and to help you reduce your risk. Often we will tell patients, listen, if you're going to get pregnant, get your diabetes under control, get your blood pressure under control, lose weight. And we will often have them meet with Dr. Graves and her team so that they can advise the woman about her risks, not only to herself, but to her fetus, so that she can do everything possible to stay healthy.
And you can have healthy outcomes if you just go along with what you're being advised and you make those appointments, and you can have very healthy outcomes for both you and the baby.
That is correct. And keep in mind that most cardiac medications, with a few exceptions, are still safe in pregnancy.
They are still safe.
And so often we will even initiate medications to make sure that you are able to get through the pregnancy without complication.
All right, thank you so much. This is so enlightening. I know you've opened a new center. You're excited about that.
Yes, well, we are opening a new center, and Dr. Davis and I are available for patients to see us, and we also work in conjunction with St. Thomas and the maternity program there, which is set up to uniquely care for these women.
Thank you. We're lucky to have you in our community. Thank you
You're
both
so
much
Thank
for coming
you.
in. And thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.